Welcome back, dear listeners, to another episode of Susan Lopresti Wellness, Mind, Body, and Soul, the podcast where we explore the highs, the lows, and everything in between when it comes to a woman's life, her health, and all aspects of navigating the midlife landscape. I'm your host, Susan Lopresti, and today I'm touching on a topic. I entitled this episode, Understanding Vaginal Atrophy, a Silent Struggle. Now, I don't know who on here has struggled with this, who knows what it's all about, but I want to get into it. I'm making it very brief. It's just highlighting it so that if you're listening and you're struggling, now you know you're not alone. There are many, many women who struggle with this, especially as we're getting older. So good afternoon, everyone. Thank you for joining me to discuss this important topic that is often overlooked or just not talked about, and it's vaginal atrophy. It's also known as atrophic vaginitis, and it's a very common condition affecting many women, especially those in and beyond menopause. And today we'll explore what vaginal atrophy is, its causes, its symptoms, and the available treatments to raise awareness and to promote better women's health. So let's get to the definition. Vaginal atrophy refers to the thinning, the drying, and also inflammation of the vaginal walls due to a decrease in estrogen. And it's often a consequence of menopause, but it can occur during other life stages. So what are the causes? Menopause is the primary cause of vaginal atrophy as it leads to decreased estrogen production. But other factors contributing to vaginal atrophy include childbirth, breastfeeding, and certain cancer treatments and surgical removal of the ovaries as well. What are the symptoms? Well, one of the main symptoms that's very distressing is vaginal dryness. Also, pain or discomfort during sexual intercourse, vaginal itching and burning, urinary symptoms like frequent urination or that urgency to go. Also, urinary tract infections can occur with vaginal atrophy. And it also impacts the quality of your life. Vaginal atrophy can significantly affect a woman's quality of life. The physical discomfort and pain can lead to a decline in sexual intimacy and satisfaction. Also, emotional and psychological distress can come from it. Also, feelings of guilt or, just like that tension between you and your partner because of this condition that's going on. And then there are social and relational issues as well. So, the diagnosis. If you suspect that you have vaginal atrophy, it's really crucial that you get medical advice as soon as possible. Diagnosis typically involves a pelvic exam and also an honest discussion of the symptoms. In some cases, a biopsy or other tests may be necessary to rule out any other potential conditions. So what are the treatment options? Well, fortunately, there are several effective treatment options for vaginal atrophy. Hormonal replacement therapy, or HRT, as it's commonly called. This involves using estrogen or a combination of estrogen and other, maybe progesterone, to restore vaginal health. And then, there's You could seek the advice of a functional medicine doctor who can give you bioidentical hormones that may help with this condition as well. And then there's non-hormonal therapies. So such as vaginal moisturizers or lubricants, and a selective estrogen receptor modulator, which is SERMS. So there's something else that you could talk to your doctor about. And then there are lifestyle changes. Maintaining a healthy lifestyle is really crucial in all aspects of health, as well as sexual health. So what do I mean? I mean a well-balanced diet and regular exercises that can help to alleviate symptoms. And I've done a pelvic floor dysfunctional episode, so go back and search that and get all the exercises that you could do to improve your vaginal atrophy. There's also vaginal laser therapy. That's emerging treatments like CO2 laser therapy that can stimulate collagen production and rejuvenate vaginal tissues. So you may want to look into something like that. And then let's talk about the risk and the benefits of treatment. Treatment decisions should be made in consultation with a healthcare provider, weighing the benefits and the potential risks. So for HRT, hormone replacement therapy, for example, has been linked to some health concerns, and it may not be suitable for everyone. Non-hormonal treatments are generally safer and can provide relief for many women. And then I want to talk about prevention and self-care. So prevention strategies include maintaining a healthy lifestyle, not smoking, and practicing safe sex. Regular sexual activity can also help to maintain vaginal health by increasing blood flow and promoting tissue elasticity. So in conclusion, right, vaginal atrophy is a common yet often undiagnosed condition that can significantly impact a woman's quality of life. With proper diagnosis and appropriate treatment, women can find relief from the discomfort and the pain that is associated with this condition. So if you or someone you know is experiencing symptoms of vaginal atrophy, don't hesitate to seek medical advice. It's essential to prioritize women's health and well-being. If you have any questions at all, please don't hesitate to reach out to me. You can reach me on my website at www.susanlopresti.com. From there, you can schedule a free 30-minute health assessment with me. You can also get access to my blog, all of my podcast episodes, and also, you can see all of the health coaching programs that I have available to you. So again, go to www.susanlopresti.com and schedule a free health assessment with me. Thank you so much for joining me here today. I so appreciate each and every one of you. If you think that this episode or any episodes that I have already published would help someone that you know and love, kindly share it out with them. Let them know. And if you're not subscribed, please hit the subscribe button today so when my next episode comes out, you will be notified. Until the next time, be well, stay happy, and bye for now. Take good care, everyone.